is this question so important to us is because Indians are at a higher risk. We have a 10-year earlier incidence of atherosclerotic events as compared to the Westerners. We are the diabetic capital of the world, and we have a large burden of atherosclerosis, which is not yet understood completely. We are seeing younger and younger patients who are getting coronary events, and unless we take this risk factor extremely seriously, we are not going to be able to conquer this very preventable disease. Now, like I said, Indians do experience a higher cardiovascular risk, and elevated LDL cholesterols are one absolutely crucial factor which have a strong and a linear association with this risk. As you all know, there are other factors like diabetes, hypertension, and smoking, but in the hierarchy of things, after smoking, it is a cholesterol which is really important to control to reduce your long-term atherosclerotic risk. And each millimole per liter reduction of LDL, that is 39 milligrams per DL, there is a 21% reduction in major cardiovascular event rates. Now, this is not a number to sneeze at, because every single millimole reduction will reduce this reduction a very large amount of reduction of cardiovascular risk. So it's not just okay to accept a 130 or a 135. When you go down from 130, 135 to 90, 95, your reduction of events goes up to as much as 21% with just that little reduction of cholesterol. Now, the latest guidelines have recommended to strike early and strike strong for intensive LDL reduction, especially in the higher risk patients. And in this regard, we have to remember the dictum that lower is better. Whether it was the 2023 ASCVD guidelines or the 22 ACC guidelines, the LDL reduction to less than 55 is a completely accepted goal now. ESC has gone far enough to say that if you've had 2 events within 2 years, then you should bring it down to less than 40. And I'm going to show you all how the Indian guidelines are even more aggressive. So if you see the lowest part of this slide, the extreme cardiovascular risk, which is category A, the LDL reduction less than 50 is recommended, but less than 30 is an option. And in extreme cardiovascular risk category B, it should be brought down to less than 30. And in the category C, it's even as low as 10 to 15. Now, does this mean that when we are bringing the LDL cholesterol down, we are increasing the risk of the patient somehow? Most patients will come and ask us, are there problems? LDL is a normal part of our body. Is it comfortable to bring it down? Won't there be long-term side effects? And the answer is significantly, it's available to us. It's not like we don't have data. The data that we have with these trials spans around 8 to 9 years. And for example, the Fourier trial, which I've put up here, showed that in 25,000 patients who showed cardiovascular benefit with further lowering cholesterol, there were no safety concerns when the LDL cholesterol was below 10. Now, and this was over a median of 2.2 years. And now look at the number of the safety margins that have been looked at. Serious adverse events, liver enzyme elevations, CKMB elevations, neurocognitive defects, new onset diabetes, and many other things. So remember, these are the things which we have been talking about regularly with statins and with other drugs which are used for this LDL cholesterol reduction. And this molecule brings it down to where we want. Plus, it tells us that there are no other concerns which we have when we use other molecules.